Morning, everyone. I'm Veronica Horn, President of the Saginaw County Chamber of Commerce. And it's good to be able to get together this morning for the second event of the Chamber's Public Policy Bite Series, Focal Point. I wish we could all be here together in person, but this is the next best thing. Now, before we get started this morning, I want to cover a few logistical things about how today's event will work so that everyone can have the best viewing experience. We'll be muting everyone except for the person who is supposed to be speaking. That way, we'll avoid the echoes you sometimes hear in the background. Today's presentation is pretty comprehensive and will take the full time allotted for the event. Therefore, we're unable to take questions during the program. However, if you do have questions about the information you hear today, just jot a note or feel free to email us at the Chamber and we'll either get you an answer or put you in contact with the best resource to answer your question. The chat feature will also be disabled during this presentation and will not be monitored by staff, so please hold your questions during the presentation. Now, to begin our program, I'd like to invite all of you to join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. One of the priorities of the Chamber of Commerce is to actively educate and advocate of issues important to the business community on behalf of our almost 1,000 members. And it's why we're here today. We also find ourselves in a completely new environment for doing business and for day-to-day living, which makes today's topic very timely. I'd like to extend my thanks and appreciation to any and all elected officials and public servants who are able to join us today, as well as all of our sponsors for this event: Dow, AT&T, Saginaw Valley State University, Consumers Energy, Great Lakes Bay Michigan Works, Next Tier, and Saginaw Future Inc. We appreciate their support as we continue to bring you informative programs to help you plan for the future. And now I'd like to welcome today's speaker sponsor, a great contributor to Saginaw County, Michael Sage from DTE Energy, to introduce today's presenters.
Good morning. My name is Michael Sage, and I'm a regional manager for government and community affairs for DTE Energy. I want to thank you for joining us today to discuss the important topic of mental health. At DTE Energy, our aspiration is to be the best operated energy company in North America, a force for growth and prosperity for communities where we live and serve. In addition to serving the energy of our customers' demands, DTE is committed to supporting our state's economy and protecting its environment and improving the lives of Michiganders. That's why I'm glad to be here today to be a part of this program. We have a very prestigious and knowledgeable panel of presenters for you this morning, and I'd like to take a couple of minutes to introduce them to you. First, we got Matt Samocki, who is the Portfolio Director for Thrive and is a steering team member of the Great Lakes Bay Region Mental Health Partnership. A former administrator with Central Michigan Science, Mathematics, Technology Center at CMU, Matt previously served also as the assistant principal at H.H. Dow High School and as a teacher at Freeland High School. He earned his bachelor's degree with a major in interdisciplinary social sciences and a minor in psychology, plus a master's degree in curriculum and teaching from Michigan State University. He earned his doctoral degree in educational leadership from Central Michigan University. With a strong commitment to improve health and sustain economic growth, he embraces high, effective, and cooperative stakeholder collaboration and positive impact healthcare, and economic success in the Great Lakes Bay region. Also, we have Dr. Janssen, is an associate professor for psychiatry at Central Michigan University of Medical and of College of Medicine, and is a director of psychiatry resident program at CMU's Medical Education Partners. She earned her medical degree from Michigan State University of Osteopathic Medicine and is affiliated with multiple hospitals in the area, including Covenant Healthcare and Genesis Regional Medical Center. Dr. Janssen serves nationally in setting and maintaining high standards for board certification as the child psychiatry representative to the American Board of Osteopathic Neurology and Psychiatry, as well as to the Board of Osteopathic Specialists. Also, we have Dr. Ashraf, a chief resident of psychiatry at CMU Medical Educational Partners, where she works with resident director Dr. Janssen, originally from Canton, Michigan. She is a member of the inaugural class of 64 students to graduate from CMU's College of Medicine. We also have Scott Taglauer is the Community Education Manager at HealthSource Saginaw Behavioral Medical Center. For the past 4 years, he has worked to market and educate local communities and referral sources statewide on the resources available at HealthSource in both inpatient and outpatient settings. He focuses on two main principles. First, that everyone who needs medical health care can find resources and access to care. And secondly, that we must remove the stigma associated with mental health care and treat it no differently than any other type of, no different than any other medical care. It should be talked about in the same way we speak about cancer, the flu, or the coronavirus. Scott's background includes more than 20 years of sales and marketing experience, with at least 13 spent entirely in healthcare. We also have Dr. Schachman, who is the Harvey, Randall, Wickes Endowed Chair of Nursing at Saginaw Valley State University. Teaching, research, and practice remain the cornerstone of Dr. Schachman's nursing career, and she has worked as a nurse practitioner in a variety of primary care settings in the U.S. and overseas. Her recent practice has focused on interprofessional primary care and behavioral health integration, with an emphasis on addiction and recovery support services. Since 2015, she has secured over $8 million in state and federal grants to support nurse practitioner education and practice, particularly through expansion into the rural Michigan. She holds national certifications as a nurse practitioner in specialties of family, pediatric, and psychiatric mental health. She is a fellow in the American Association of Nurse Practitioners and has received numerous teaching and research awards. And now, to begin our program, please welcome Matt Samocki.
Good morning, everyone. Again, my name's Matt Samocki, and just giving you a brief overview here of Thrive and as a joint initiative between Mahela and the Great Lakes Bay Regional Alliance. So our vision is a thriving Great Lakes Bay region with transformed healthcare, exceptional community well-being, and a vibrant economy. And our mission is to achieve improved healthcare and sustained economic growth in the region through highly effective and coordinated stakeholder collaboration. And one of those pieces that we are working on currently in our phase 1 interventions is mental health, looking to reduce gaps associated with stigma, information access, and quality care. And one of the key pieces I want to make sure that really get us grounded for the rest of the presentation is a definition of mental illness. So this definition is adapted from the American Psychiatric Association. First of all, mental illness is nothing to be ashamed of, and it's a medical problem just like heart disease or diabetes, similar to what was written in Scott Taglauer's bio. Mental illnesses are health conditions involving changes in emotion, thinking, or behavior, and it can be a combination of any of these. They are associated with distress or problems functioning in social, work, or family activities. Mental illness is very common. It's also very treatable. And the vast majority of individuals with mental illness continue to function in their daily lives. As you'll see in a little bit, as I'm going to show some statistics, mental illness does not discriminate. It can affect anyone regardless of your age, gender, geography, income, social status, race, ethnicity, religion, sexual orientation, background, or other aspects of culture. It can also take many, many different forms, from mild, that can only interfere in maybe limited ways with our daily lives, or other mental health conditions are so severe that a person may need care in a hospital. Example treatments can range from calling or texting helplines, support groups with a number of people attending. Could be one-on-one treatment sessions, teletherapy, which is really taken off since COVID-19 and the pandemic, and there could be medication. Treatment can also be intensified beyond the outpatient level with partial hospitalization, intensive outpatient programs, hospitalization at a psychiatric hospital, and interventional treatment such as ECT, TMS, and ketamine. Now that we're grounded in that definition for mental illness and some of the treatments that are available, one of the things that we want to make sure that we're looking at is the economic impact for mental illness. And these infographics do a nice job of grabbing that. And the sources for all of these infographics are always found in the bottom left-hand corner. And I'm sure the Chamber will be perhaps sharing these slides, which I'm completely fine sharing them as well. But 210.5 billion lost earnings per year in the United States alone due to mental illness. The United States, depression ranks among the top 3 workplace issues and is also the leading cause of disability among people aged 15 to 44. Positively, though, treating any mental illness leads to an estimated return of $4 for every dollar spent due to the increase in people's ability to get back to work and function in their daily lives. I'm not going to read all of this to you, but this does a nice job of showing, again, how mental illness is going to be affecting everyone. And roughly 19 to 20% of all adults will experience any mental illness in their lifetime. And that's a really important piece that I want to make sure that I stress here. Thinking about the mental illness definition I gave previously, again, it can be extremely mild to severe and everywhere in between. As adults during our lifetime, again, 1 in 5 or roughly 20% will experience any type of mental illness. And I've given this type of statistic before, and I've given this type of speech many times, where people are very fixated on severe mental illness, thinking that 20% of the population at any one time is running around with severe mental illness. And that's not the case. So I want to make sure that we keep grounded in that mental illness definition. That again, it can be ranging from very mild, where we can function in our daily lives, to severe, where we may be looking at more intensive treatments or psychiatric hospitalization. Again, looking at statistics, looking at race and culture. Again, it's not going to discriminate. However, some demographic groups are more likely, but that's an entirely different speech that we don't have time to get into at this time. Looking at the United States data, 23% of adults diagnosed with any mental illness say that they have unmet mental health care needs due to the following reasons. One is stigma. Really, people that are thinking that if they're going to be seeking care, that they're going to be judged, that they're less than, and really people thinking that a mental illness is something to be ashamed of, when again, if you're looking at those statistics, it's very common and it's very treatable. But stigma is a big problem. Lack of information, knowing where to go, knowing where to turn for help. How do I navigate insurance? Being able to find a provider close to me. being able to find a provider that's going to have treatments that are going to fit my needs. So lack of information is a big problem, but we're doing a nice job in this region of working on. So we're fortunate that way because it's a very big problem. And then lack of access to care, being able to actually go see that provider. You're going to see in a little bit that we have a big provider shortage, and that's one of those big reasons why we have a lack of access to care. Bundled with that, again, financial issues, could be transportation, any number of reasons why people perhaps can't access the care that they need. So again, here's that statistic. In any given year, 1 in 5 adults will experience any mental illness. Over the course of their lifetime, for all adults, that number could be closer to 50%. So in any one year, again, 1 in 5 could be experiencing a mental illness, but over the course of their lifetime, that number could be as high as 50%, according to a study done a few years ago. If we take these statistics and apply it to the Great Lakes Bay region using census data, that would mean that roughly 157,000 adults will experience any mental illness in their lifetime out of a population in the entire region. If we define the region as Isabella Bay, Midland, and Saginaw County, that puts us at about 450,000. In terms of adults, that would put us probably a little bit closer to between 250 and 300,000. So that's a very high number that could experience any mental illness. Again, using census data, if we were to apply that regionally, that would mean for Bay County, that could be 37,000 adults, Isabella County 24, Midland 29, and Saginaw 66. So mental illness is something that if maybe you're not experiencing right now, there's a good chance that there's a coworker or someone in your life that is experiencing mental illness or has gone through and experienced mental illness. So the problem is here, and that's one of the reasons why we're talking today, is we want to make sure that we're proactively addressing it and getting people help that they truly need. In terms of youth, those statistics are more difficult to get to. This is national data from the National Institute of Mental Health, but roughly that number again, about 20% of youth between the ages of 13 and 18 have a mental health condition. 11% could have a mood disorder, 10% can have a conduct disorder, and 8% can have an anxiety disorder. So it's a very prevalent issue within our schools as well. And a lot of those students that move on from K-12 schools and go into higher education, that's a very common time where the onset of mental illness can begin. So we know that it's a prevalent issue within our higher education systems as well. And in terms of a provider shortage, this information was taken between the Robert Wood Johnson Foundation, County Health Rankings, and census data. And for the Great Lakes Bay region to be in the top 10% for mental health providers, the Great Lakes Bay region will need 311 new providers. And that's across the spectrum. So when we're talking about mental health providers, what are they? That can be a licensed counselor, psychiatric nurse practitioner, psychiatrist, psychologist, and social workers. So there's a great need in our region for new providers, but I also want to stress that this is not a Great Lakes Bay region phenomenon. This is true across the country. We're very much in need for mental health providers because the problem is so prevalent, and we need to be able to help the folks that live in our communities. If we were to break that number down per county, that would mean for Bay County, we would need to add 78, Isabella 42, Midland 70, and then Saginaw County 121, again, based on census data. So in closing, as we continue to think about mental health, the definition of mental illness, potential treatments, and the gaps and needs that exist, I'm very pleased that everyone is with us today to learn a little bit more. so we can make sure that we're helping our neighbors, our friends, our families, and those in our communities. And I know that we have a number of really great speakers lined up throughout the rest of the day. But if you have any questions, my contact information is on the slide as the Thrive Portfolio Director. And you could also find my information if you were able to either Google Thrive, Mahela, or Great Lakes Bay Regional Alliance, or on the bottom left-hand corner, there's thrivegreatlakesbay.org. So, and with that, I'd like to now please welcome Dr. Furhut Janssen.
Dr. Furhut is having some difficulties joining us right now, so if you don't mind, I think we'll move on to Scott Taglauer, and you can talk now.
All right. Thank you. Thanks for the Chamber for doing this. It's great to be part of it. It's a great thing that we get to share or look at and talk about this, because one of the things in Matt's slide, and one of the things that I really look at is removing that stigma that mental health is something we should be ashamed of or we shouldn't really talk about, and that's so untrue and it's so unfair. And hopefully by conversations like this and meetings like this, we can start to break down those walls. And for whatever reason, my slideshow is not working. There we go. I am going to start my slideshow back. It will not come up, but we'll figure it out. I'll just go from here. So at HealthSource, we have a 109-bed psychiatric hospital, and we break that down in 3 different units. We have our geriatric unit for older adults, typically 60 years of age and older. This is a segment or a population that we just added in 2019, the second half of the year. It's a population that really gets overlooked, and it's unfortunate because a lot of these individuals got us to where we are today in society, and I feel that they're getting passed over a little bit. So we have a 16-bed unit with 2 private rooms and 7 semi-private rooms. Unfortunately, right now with COVID and this population, it's very difficult for us to keep social distancing and keep some of these patients healthy. So at this point right now, we only run a census of 9 beds. Everybody's in a private room so that during groups, during meal times, we can appear to the 6 feet apart. We try to get people to wear masks. We're just trying to, help this patient population with the needs that they have, and also keep them and our employees safe as well. It's difficult to do, but we're doing the best that we can. Our adult unit is for those patients 18 years of age and older. We have a 60-bed unit. Once again, with COVID, and we can't run at 60 just to keep everybody safe, keep our social distancing. So right now we run a census of around 40. Everybody's a no roommate when they get to our facility to keep them safe, and after we get to monitor them for 5 days or so of their signs and symptoms, and it doesn't look like they are positive for COVID, then we can adjust and our rooms around. We can give them a roommate so we can accommodate more. But right now in our adult unit, we're only running a patient population of around 60% of our total availability. Our adolescent unit is children 8 years of age to 17 years of age. We try to segregate those patients not only in separate hallways by gender, but also by age. It's very difficult for younger kids ages 8 to 12 to interact with those that are 13 to 17. It's very intimidating for them on instances. And then with the older ones, it's very annoying. The younger kids are a little annoying to them. So we do our best to break up those groups into different groups, into different meal times, just to keep them a little bit separated from one another. We find that it works best for a reduction in the number of one-on-ones that we need. And also it's better therapeutic for the patients while they're here. We do have a 33-bed unit. We are only running at a census of about 19 or 20 right now, just to here with COVID and social distancing as well. We also have, because mental health is so tied to co-occurring disorders that may be drug or alcohol abuse, we do have a chemical detox unit. It's a 7-bed unit. We only run at 4 right now to keep social distancing because we don't have the ability to get testing back in time. Typically, a detox facility like ours will run anywhere from 3 to 5 days. So by the time, in some instances, by the time we get the testing back, they may be COVID positive, and they'll already be out of our facility. So if we can keep them as a no roommate for as long as possible, that's why we're only running at 4 beds at the moment. Just to give you guys a little snapshot and to kind of piggyback off some of the statistics that Matt gave you, and what kind of need we have in our area in surrounding counties. In 2019, we did 2,864 admissions for 24,500 patient days. And those are just on our geriatric and adult and adolescent units. Our chemical dependency did roughly 500 admissions with 1,500 patient days. For this for our adult, our geriatric and our adolescent units, we fielded 11,316 inquiry calls just for hospitalizations. We have a 109-bed unit. There is no way we can accommodate every call that we get. And that's unfortunate. And I'm glad part of this conversation is that we're going to talk about the needs going forward. We could build more beds, we could build more walls, but we need more professionals. We need more doctors, we need more nurses, we need more techs. And I think we'll get into that later. In our outpatient clinic, we did 7,500 outpatient clinic visits. So that's 4.5, because we have 1 part-time counselor, but that's basically 4.5 social workers seeing 7,500 patient visits per year. That's a lot of visits. We could do twice that if we had more social workers here. Not everybody needs inpatient hospitalization stay. This area, Great Lakes Bay region, we're pretty lucky to have the resources that we have. Our hospital holds 109 beds. We have Bay City that has Bay McLaren that has 23 adult beds and 16 geriatric beds. And you had Mid-Michigan, Midland that has 12 beds as well. That's a lot of resources for this community, and it's still not enough, but I think we should be thankful for what we have. We're lucky to have what we have, and hopefully we can build on the resources that we have to help as many people as we can. That's really all I had for everybody, unless there were some questions, but I think we'll hold those till later or some other future time.
Okay, I think, and then Dr. Furhut Janssen is available. Scott, thank you very much. That was fantastic. So now please welcome Dr. Furhut Janssen.
Dr. Janssen, can you hear us? We can't hear you. Can you see if you can, it shows you're unmuted though.
Dr. Janssen, in the bottom left-hand corner of your screen where it says mute and then there's an up arrow, if you click that, then it has select a microphone.
That should work.
Yay.
All right. Today has not been a good day for me. I hit construction and then I had these audio problems, so my sincere apologies. And I am smiling because I am seeing names of people that I've interacted with and written grants with and not have actually met in person. So it's just lovely to be here. So I guess what I am supposed to talk about is resources in the area and our program. And I didn't make up any slides. I think that what I can share with you is the mission of our program, which started to be built in about 2011, 2012. They started the idea of building it. And the mission was to really, as a part of educating medical students. The medical school was started in Mount Pleasant. It was necessary that future physicians have an understanding and a proficiency in treating mental health diagnoses. And so as a part of that, the psychiatry residency was started. But our specific mission has been to grow, train, and retain psychiatrists in this area. When it started, I wasn't here when it started, and it started with, I think, 2 or 3 psychiatrists. And the beautiful thing about this area is the resources were rich. There were, many behavioral health organizations. As Scott talked about, HealthSource was right there, and HealthSource has been the major partner in this residency. The growth that Scott spoke about in terms of the increasing beds on the child unit and particularly the geriatric unit has been a partnership between CMU and HSS in developing, the beds and then the faculty to staff those beds, and then provided not only the access for patients, but the opportunity to train for our residents. So we started with 2 or 3 faculty. When I hired in, I was the first board certified child psychiatrist in Saginaw in quite some time. And I walked into 8 residents who at that time, the residency was strictly at Covenant and at HealthSource. And so we just graduated our 3rd class. So over the course of the last 6 years, we have been blessed, as Scott referenced, with being able to partner with the rich resources that exist in this community. So we were able to create outpatient rotations for our adult psychiatry residents. And through that, we have, I think it's a little bit better now, but for a period of time, our residents were kind of the access for patients. There were so many psychiatrists that were not able to take new patients. And so our 4 residents had slots open to see the psychiatric patients of this county and beyond. Our residents actually will see patients from really far north who will drive to see us as their primary psychiatrist. When you are a psychiatrist or a nurse practitioner or a PA or a therapist that's providing these services, we're always looking for where to refer a patient to. And the beautiful thing about this area is that we are able to refer pretty nicely to supports for families and patients, whether it's for substance use, severe mental illness, treatment-resistant depression, and other diagnoses like that. I think that from my standpoint, I was asked to speak on the resources, and as I started to develop what I was going to speak about, I started thinking about my journey and the residents' journey, and each and every time, it's just been the energy, the momentum has been just so positive and so well-intentioned and geared towards let's help the citizens of this area have better mental health. And so there were community champions at every partner that we have, whether it was Covenant or HealthSource or Great Lakes Bay or the VA. And so I really thank them for helping us develop our program and guiding us to the resources that already exist here. I think that I have been really blessed also to see the area develop. And so one thing that Scott wasn't here when this happened, but we would always kind of struggle with the patient in crisis. And so a patient in crisis comes to the hospital, but hospitalization may not be the right thing for the patient. And so then you're left with, is the patient truly safe to go home? Is the patient not sick enough or not meeting criteria to be in a psychiatric hospital? And we kind of had this middle area where we didn't have that intensified treatment. And a couple of years ago now, McLaren Bay opened up their partial hospital program, where if outpatient treatment is failing or a patient doesn't meet criteria for a psychiatric hospitalization, they can attend that partial hospitalization program where they go every day. They have therapy, they see a psychiatrist, they essentially have a hospitalization without having to go in the hospital. That has been a huge, huge impact on our community, and to have that available, I will say probably has saved hundreds of lives. As we know, Barb Smith, Survivors of Suicide, is a really rich resource for our community. We work very closely with her on access. She'll call us directly with needs that she has, and we're able to put that pretty well together to direct patients that are in crisis that she deals with to have intervention very quickly. Let's see what else. I think I had 10 or 15 minutes, but as far as resources, I think, Scott did a really good job in describing that, and I gave you a little bit of a history of our program. I will tell you that we started the Child and Adolescent Psychiatry Fellowship, and this is our second year of that. We know that having psychiatrists available to treat children who are chronically ill or have severe behavioral problems is very hard to develop and come by. But when I wrote up the application for that program, it was almost immediately accepted. And the reason why is everything was right here. We already had numerous behavioral health organizations that were treating children. We had HealthSource that had the child psych unit. We had Westland that was doing some trauma work. CMH was here. All of the organizations had therapists in the school. And so it was very easy for the accrediting organization to say, this is absolutely where child psychiatrists should train. Through that program, we have now 7 child psychiatrists that are now seeing patients as outpatient. So we have increased the access for our children and families. And we do a lot of work. I'm sure you've heard about the ACEs initiative, and we have done a lot of work in that arena as well. So I hope that's helpful. And I think at this point, I can direct you back to Matt, who will have our chief resident, Dr. Ashraf, share some things.
Thanks, Dr. Janssen. Yep, so now next, please welcome Dr. Mahela Ashraf to talk about the programs and efforts at CMU to address mental health care.
Thank you, Matt. Good morning, everybody. Thank you so much for this opportunity to help, understand our program a little bit better. So with regards to CMU Department of Psychiatry, I think as what we really bring to this resource, and speaking as an alumni of the inaugural class for College of Medicine here, I've been here now, by the end of my residency, I'll be in Saginaw for about 8 years, have really seen this community grow over time. And with regards to the Department of Psychiatry, I think we contribute an integral intellectual resource to the community. What I mean by that is education for the community that begins with patient care. So that's really our first reach in the community, is to connect with our patients, whether we're seeing them in the inpatient facility, outpatient facility, in the hospital, and kind of having that dialogue with them about the nature of their illness, their diagnoses, whether it's clearing up the diagnosis, as we often see a lot of overdiagnosis of certain mental health conditions in this area, as well as an understanding provided to them about their treatment plan, having a more evidence-based treatment plan approach as opposed to sort of the colloquial treatments that may have existed in the community before. Substance use counseling, lifestyle education, keeping in mind social barriers that they live within in the community, because it's one thing to educate about the best ways in which to approach their mental health, but if they don't have access to those resources, it's going to become very difficult for those patients. And through that patient-centered approach, kind of working to eliminate, as previous speakers have said, the stigma that exists with mental illness. And I think just having our patients have that platform to have a safe dialogue with their providers allows first for them to have a better view of what their mental health versus mental illness means. And from there, it can kind of disseminate throughout their families and friends and such. The next part of the intellectual resource that we contribute to this community is education for medical students. So as my colleagues in the department and I, as residents, we work closely with the medical students that are part of CMU College of Medicine. And it's through that interaction that we hope to pique their interest in mental health, and hope to draw these medical students into the field and become mental health care providers. And even if they're not becoming mental health care providers, to become mental health conscious providers. And I think that comes with the experience of, good rapport in hearing what their own inherent biases, as I've learned in, just being a resident in the program, might be as providers, and kind of working to have a safe space to express that, as well as build on to better view and have a better lens of our patients. And then the third portion of this intellectual resource that we're bringing to this community is education for other providers, anywhere from mental health techs to specialists in the region that we would come in contact with. These might be emergency care providers, nurse practitioners, PAs, primary care providers, consultants, that we interact with when we're learning about our patients and hopefully communicating with, to clarify a diagnosis or collaborate care for our patients. And so that, again, is that holistic care that, is provided with regards to mental health care for a patient, keeping in mind that it's a combination of both their physical and their mental health. So I'm notorious for being a fast speaker, but that, from my perspective, is kind of what I wanted to highlight, as I know other speakers have highlighted on the actual physical resources. So thank you so much, and that's all from me.
Thank you so much, Dr. Ashraf. And now please welcome Dr. Kathleen Schachman with information on the ways Saginaw Valley State University is working to address mental health care.
All right, let me see if I can get my screen up. Sorry. All right, can everyone see the screen? Okay. Okay, I'm going to proceed because I haven't heard anything. So as discussed by our previous speakers, we're really facing a healthcare shortage in terms of behavioral health workers. And we're really falling short on the ability to meet the needs of our population, particularly those in rural and geographically isolated areas of Michigan. So most behavioral health specialists, whether they're psychiatrists, social workers, they're really concentrated in lower Michigan. Here, we're looking at counties in Michigan that have no psychiatrists. We're looking at this in orange. And the counties in blue are even worse off. They have no psychiatrists and no psychologists. This comes from Alterum, and it was a study that was put out last summer. Now, nurse practitioners are uniquely poised to step into that gap, to assess, to diagnose, and to treat individuals who have mental health and substance use disorders. Specifically, nurse practitioners who have specialized training as psychiatric mental health nurse practitioners will have the necessary skill set to really, and the expertise to deliver that safe and effective mental health care to this vulnerable population. So there are just over 4,500 nurse practitioners in the state of Michigan, and only 3% of those are psychiatric nurse practitioners. So that turns out to be approximately 135 psychiatric nurse practitioners in the entire state of Michigan, 135. So one of the things that Saginaw Valley State University has done is we developed a psychiatric nurse practitioner program. We launched that just over a year ago. It's a program that's 24 credits, and the students attend part-time over 4 semesters, and it's nearly completely online. And this is what's called a postgraduate certificate program, which means that all of our students are already nurse practitioners. They're family nurse practitioners who have really been on the front lines of primary care across rural Michigan. And they have recognized that they really need to broaden their expertise so they can incorporate psychiatric and substance use treatment in their primary care clinics. And so we did receive significant federal funding, almost $3 million, that helps the students to pay their tuition and fees. Our goal is to, by 2023, is to graduate 100 psychiatric nurse practitioners. And I'm happy to say we're almost at the 50% point. We'll be graduating the first cohort of students, 14 students. We have started off rather small. The next cohort right behind them is 38 students. So we're almost to that halfway point. And it brings me back to when Matt was talking about the fact that we need over 300 mental health care providers just to fill that gap. So we are trying to do our part to kind of chip away at that. We do have a focus in this program on rural health, on addictions, and technology, which has really helped us when with COVID, many of our care environments turned to telehealth. Well, we were uniquely ready to do that because our students are specifically trained on how to use technology in the care of mental health conditions. The other thing that we're working on currently is a second initiative is the application of an innovative model that uses technology to expand specialty treatment capacity in remote and underserved areas. Project ECHO stands for Extension for Community Healthcare Outcomes, and it uses video conferencing technology and case-based learning to link interdisciplinary specialist team with multiple primary care clinicians. And so we have a hub team that may have expertise in a variety of specialty areas. Maybe it's hepatitis C, maybe it's autism, maybe it's breast cancer. But there's an expert hub team that's interprofessional. And through video conferencing, they connect up with a variety of primary care clinics in some of these rural and underserved areas, so that these primary care clinics learn from the expert hub team how to best deliver evidence-based care to their population. So you can see this model is really a force multiplier, where the expert hub team and the primary care teams are working together to help deliver the right care to the right patients at the right time within their community. So it's really kind of a telementoring approach. And so not only do the patients benefit, but also the providers who are in these primary care clinics really have the ability, they don't feel so professionally isolated, and they have the ability to connect up with and share care with this expert hub team. So in October of 2018, Saginaw Valley State University decided to create a Project ECHO here. We were only the third Project ECHO in the entire state of Michigan, and our focus was on substance use disorder because we saw this as a really critical need, a critical gap, that there are a lot of individuals in primary care settings, particularly rural, who want to take care of their patients better, those who have substance use disorder, but really potentially were lacking the confidence and the competence to do that. And they didn't feel like they really had a good backup system. They wanted to help these individuals. And so we launched our Project ECHO to specifically to increase the confidence and competence of these healthcare teams. We also wanted to increase the number of providers in rural Michigan who have a waiver to prescribe buprenorphine. Buprenorphine is a medication that can be used to treat opioid use disorder. So we began our Project ECHO back in October 2018, and we have these video conferencing sessions twice a month, the first and third Wednesday from noon to 1:30. And we have an expert hub team who has expertise in addictions, and we connect with rural clinics across Michigan. And so our initial goal was, okay, we want to get at least 5 rural Michigan clinics on board. We'd love to connect with 5 clinics across the state. So I'll let you know how that went in a minute. This is our hub team. Now, obviously this is pre-COVID, but sitting around the table, we have a peer recovery specialist. That's someone who is in long-term recovery himself. We have a facilitator. We have Dr. Maroney, who's our addictionologist. We have Matt Mitchell, who is a substance use counselor. Jen Kreiner, she's a psych mental health nurse practitioner. And finally, Jill Covio from Ferris State University, and she's a pharmacist. So we have a really interdisciplinary hub team. So let's show you some of our, whoops, oh no, how did that happen? I need to go back. Okay, so now we have our spokes. These are individuals who are connecting from across Michigan, and they represent a variety of professions. Maybe it's administration, many students. There are probably about 5 or 6 students. I know we've got some CMU students who have presented cases here. We have students, social workers, physician assistants, physicians, residents, nurse practitioners. So we have a variety of individuals who join us every Wednesday. And this session begins with a brief didactic presentation from, sometimes it's a guest speaker. Last week it was an addictionologist from Columbia University talking about urine drug screens. So we have a brief presentation by the expert group, and then someone in the audience presents a case. It's a complex case that they're struggling with, that they really need the guidance from this expert hub team, and it's very much an all teach, all learn approach. So this is pretty typical, but generally on our sessions, we have almost 50 individuals who call in every Wednesday. So we have a really good and robust participation. So now let me move forward. So remember I said that I really wanted 5 clinics across Michigan to participate. Well, as of last month, these counties here that are shown in dark blue have had individuals or clinics participate. So we vastly exceeded our expectations. So when you're looking at the darker blue areas, those are individuals and clinics who have participated across Michigan. But it's not just Michigan. We have people from over 30 states who are calling in and participating in these sessions, in addition to 3 other countries, Canada, Sweden, and Tanzania. Don't know how that happened. But anyway, so we've had really good participation. We're now starting our 2nd year, and we're starting to expand. So this is one of the, probably the most successful initiatives that SVSU has undertaken. We also have established through grant funding through Michigan Health Endowment Fund, something called the GRACE Project, which stands for Gaining Recovery in Addictions for Community Elders. And so this is, I believe, it's still the region's only outpatient that is specific to the older adult population for the treatment of substance use disorders. And so we have a variety of, and it's student-led, and so we have a variety of students, not just from Saginaw Valley State University. We have students from Michigan State, we have students from Ferris, and these are students, again, it's interprofessional, so we have social workers, nurse practitioners, pharmacists, occupational therapy, physical therapy. And so this is really an opportunity for these students to learn. And I love the term that was used, mental health conscious. And so this is an effort to really provide that exposure and that opportunity for students to connect with individuals or older individuals who are struggling with mental or with addictions in this area. And then finally, we have just very recently established a Center for Rural Behavioral Health and Addiction Study. And so this is a very new initiative that was starting just kind of right when COVID hit. So we haven't made a lot of headway on there. But it's our vision is that this center is going to unite practice efforts and help to build some vital community partnerships within our academic environment, which we hope will really drive evidence-based, solution-oriented responses to the current behavioral health crises that are impacting our region. And so our objectives really are to achieve goals that are based on 4 pillars. These are congruent with the mission and vision of Saginaw Valley State University. But educational excellence. We really want to develop and test some novel educational models. We want to increase the confidence and the competence for individuals who care for those who have mental health and substance use disorders. And certainly we invite collaborations with other academic institutions, so I was glad to see CMU here. And we really want to promote some curricular and interprofessional opportunities. Scholarship and scientific advancements, we're looking to investigate emerging educational and practice models that are going to improve care and access. Community engagement, we hope to achieve this through advocacy to increase access and quality improvement in mental health delivery. And then finally, practice innovation, where we really hope to promote integration of primary care and behavioral health services together as an effort to reduce stigma, to facilitate access to care, and also to improve health outcomes among rural populations. So just in summary, those are the basic 4 initiatives that we're currently undertaking at Saginaw Valley State University. The implementation of our new psychiatric mental health nurse practitioner program, Project ECHO, which focuses on substance use disorder, GRACE Project, which helps to deliver substance use treatment to the older adult population, and then finally the recent establishment of the Center for Rural Behavioral Health and Addiction Studies. So that is the conclusion of my presentation, and I'm going to turn it back over to Matt.
Thank you so much, Dr. Schachman. That's fantastic. And now please welcome back Dr. Furhut Janssen, who is going to take a look at the future of mental health care and where we go from here.
Can you guys hear me? Okay, so wow, what tough acts to follow. All the presentations have been wonderful, and I guess that's what I think about when I think about the future. Our future is really bright. When I am listening to Dr. Ashraf and Scott and Dr. Schachman and all of the things that they are saying, it really is a very higher order level of preparation and project initiation, and thinking very carefully about what this area needs and what our healthcare pipeline needs and what our citizens need. And I think that that's what we can really look forward to and be excited about, because I've been in medical education a while, and I can tell you that I've worked in psychiatry at various places in the state, and I've never experienced the momentum and the thoughtfulness and the partnership that we have here in Saginaw. So the fact that we have, think about where we started 5 years ago, where we had healthcare organizations, but we really didn't have the development and the growth of people that were going to be caring for our citizens. And so we had really a focus on adult psychiatric care. And in that 5 years, we have now grown. We have trained 20 psychiatrists. We have, I can tell you from our graduates, 75% have stayed in the mid-Michigan area. So, you know, our mission is being fulfilled, and SBSU's mission of 100 psychiatric NPs, that's really going to strengthen our workforce in a short order of time. If you think about what Scott mentioned in terms of the unit development, that's really important because when we are interviewing candidates to come to Saginaw and train with us, 5 years ago, I was saying to them, well, you know, I think, you know, we're going to have a child psychiatry fellowship and I have to work on developing it. And, you know, we are going to have geriatrics. And, you know, when you're saying that to people who want to train in psychiatry, it is much better when you have diversity of your curriculum. And all the speakers today have demonstrated that in the last, you know, 3 or 4 years even, we have really specialized what we have here in the area. So we have a partial hospitalization program. We have these projects directed at substance use. We've got geriatric psychiatry and hopefully soon outpatient geriatric psychiatry. We've got child psychiatry, and this year we've developed the outpatient child psychiatry clinics. So not only do we have mental health psychiatry, we are really specializing the care. And how awesome is that? How awesome would it be if we had a patient who needed specialized psychiatric care and we didn't have to send them to Ann Arbor and we didn't have to send them to Cleveland Clinic or something? I mean, you can if you want, but our goal is to be able to have that here, and we are well on our way. I think the future also will hold integrated care. I was a little bit late to the call, and so I don't know how much integrated psychiatric care into primary care has been discussed. It is certainly already happening at Great Lakes Bay Health and happening well. I know Mid-Michigan also has clinics in which they're doing that. Project Echo is a great example of delivering mental health care into the hands of primary care clinics. So I think we're going to see more integrated care, more co-located care, more of, how do I want to put this? More comfortability of everyone who's in healthcare in treating and addressing mental health care needs instead of waiting for, you know, a psychiatrist. That happens now, but I think with these integrated types of models, we're really teaching our students that this is a part of whole health and it's a really important part of medicine, and that stigma is decreasing the further we go on. And I've seen a huge shift in the last couple of years as far as that goes. You know, if you asked me what my 5-year plan was, I see us really being a specialized center for mental health and working side by side with our community partners and, you know, the residency and the nurse practitioners, melding together as far as offering our trainees what they need to do. We have a PA school as well. So we have everything that a major medical center and a major medical hub would have. And I just see that continuing to grow. You know, HSS has 3 units. The geriatric unit opened a year ago. I think that we are going to see, hopefully, more specialized intensified care. And what I mean by that is, if you travel to Grand Rapids and you looked at their mental health care, they've got an emergency psychiatry center. So how awesome would it be if we had something like that? if we had specialty partial hospitalizations for postpartum women to help solidify that bond and to avoid hospitalizations for mom, eating disorder partial hospitalizations, adolescent substance use partial hospitalizations, all of these specialized care niches we need to develop, and I have no doubt that eventually we'll get there, but these are kind of the long-term goals. And you've got the brain power here. Every stakeholder in this community has the same kind of long-term vision. And Matt will laugh, Dr. Samocki will laugh, because I always tout this as my major goal is we need more interventional psychiatry, more modalities in this area. So in short order, we will have more ECT, more TMS, ketamine, maybe psychedelics, all of the newer specialized treatments that kind of get in the hands of larger communities first, we need to have here. So when we have the patients who have treatment-resistant depression or treatment-resistant schizophrenia, they're not getting hospitalized over and over. They're receiving an intervention that helps them stay in the community and actually have some remission of symptoms. So those are the pieces that I see in the future. It hasn't been widely announced, but last year, CMU, in partnership with the Great Lakes Bay Mental Health Partnership, applied to be an associate member of the National Network of Depression Centers. We were approved as an associate member. And so we're still working out some of those details. And what does that mean for our area? That doesn't mean that we're going to have a brick and mortar depression center. That's not what it means. It means that we're part of the nationwide organizations, and we're the first actually community organization in that association. But typically you have the larger universities, you've got Yale and Columbia and Stanford and like various hospitals across the country, psychiatry departments, and that we are all members, we're an associate member of this depression center organization, or network of depression centers. So what we do is, the idea is to drive the research into the communities. So we will be participating in that, and as you know, we have a steering committee, and we will be looking region-wide to determine what initiatives we should participate in, and together that nationwide organization will develop new treatments that are based on evidence that will come to our community as part of that partnership and being a member of that community, so of that organization. So that is super exciting, and a really big feather in our cap for our region, and I'm excited for it to someday be announced. And then as far as other future things, I mean, I think I've talked a lot. I'm just pie in the sky. I'm a dreamer, and I really think that we have great things coming. So thanks for listening to me kind of blab on and on, but I'm really honored to be here and with these speakers as well.
Well, thank you, Dr. Janssen. Thank you, Matt. Thank you, Dr. Schachman. All of you, thank you so much. Dr. Ashraf, thank you, Scott. I've been taking notes because, as those of you that know me, I do have a background in mental health many, many years ago, but it's always been a subject near and dear to my heart. And the exciting news for this community and this region is as Dr. Janssen said, we are like beginning to be a hub for mental health. And that is so, it does a lot of things. I mean, it is going to offer some true hope for those people with mental health issues. We're going to mainstream mental health issues and mental illness. We need to. Because just like if you had anything wrong with you, you're going to go to the doctor. And for too many generations and years, we've hidden this. And it's time that we stop hiding depression and all of those issues of mental health, substance abuse. It's been a subject near and dear to the Chamber's heart. It's going to help us be holistically a healthier community, which does a lot of things. I mean, we're going to be, number one, adding training. The impact on economic development is unlimited. And so from a selfish economic development standpoint, this is a wonderful addition to our community. And it goes a long way to our efforts for talent attraction and retention. We do want to be the center for mental health services, not just in Michigan, but you folks out there heard how many states, almost nearly every state in the United States is looking towards Saginaw Valley State University, Saginaw, Michigan, Central Michigan University for advice and what we're doing right, as well as other countries. So I can't be more excited and proud of the programs that are developing. So I want to thank you all for your efforts. Thank you all for everything that you're doing for the community. And thank you for this presentation. And we would like to do this again live, hopefully, maybe next year to see where we are in the progress. But we want to get everybody excited about these opportunities. HealthSource Saginaw has been a gem in our region for mental health and substance abuse services. And so we want to thank you again. But before we leave, I also want to thank our sponsors. Once again, Saginaw Valley State University, Dow, AT&T, DTE Energy, Consumers Energy, Next Tier Automotive, and Saginaw Future Inc. And then these great sponsors are also very concerned and want to have great EAP programs and mental health programs. And with the help of this group, we're there. So before we go, I want to let you know that the Chamber is going to be holding a virtual perk breakfast day after tomorrow, this Thursday, July 16th, to discuss the state's budget. We'll have the Senate Majority Leader Mike Shirkey and Saginaw's Senator Ken Horn with us to talk about the budget and what we're looking at moving forward. Watch for your emails. You should have gotten emails, and we need you to register to participate. The Chamber will continue to communicate current information that impacts local business through our website, www.saginawchamber.org. Our newsletter is At a Glance, and then email updates certainly. We want to thank you for participating in today's webinar and hope you've gained some new information and perspective. We hope you're excited about this great news and the importance of mental health care to the overall health of our community. Again, if you have questions for any of our participants, get those to us. We'll get those to one of the doctors, Scott, any of the people that have presented today, and try and get you more information. But other than that, have a wonderful day, be healthy, and enjoy the rest of the day. Thank you.